Have you taken any like pain reliever or anything?
Oh,
or Edgar?
I have this, is that naproxen? Is that what that is?
Yes.
Naproxen, so I'm supposed to take 2 of those.
What the point of that is that you try to prevent symptoms rather than chasing.
Right, because I was reading, like I read the video blogs on YouTube, and there's some people that are taking different MS drugs, and they talk about, taking them and the reactions that they've had. And this one girl was talking about taking her first Avonex injection, and she was talking about how feeling all feverish and just kind of yucky.
You kind of get like flu-like symptoms.
Right.
And the reason for that is because this is an interferon, and when we get the flu, our body produces this natural interferon that gives you the flu-like symptoms. So it's not the medicine that gives you the flu-like symptoms. Basically, it's your body's response to it, essentially. Do you know the side effects of this medication?
I know that, like, besides flu-like symptoms, maybe is depression one of the things that could possibly be?
It can probably make it worse if you maybe suffer from depression.
Right.
Seizures, not very likely, but there have been some people in the study group that have a few seizures. So they pretty much have to list that as a side effect, whether related to the medicine or not. I don't know. You probably won't have very many symptoms today. Your doctor is actually starting you off in quarter doses.
Oh, okay.
So we're going to do a quarter dose today, and the next week you'll do a half a dose, and then the third week you'll do 3/4 of a dose, and then the fourth week you'll start doing the full dose.
Okay. How does that work? Do you like inject like a quarter of what's in the vial, or?
Yeah, I'll teach you how to squirt it down.
Oh my God. Mm-hmm.
One of the things that your doctor's probably been doing too is monitoring your liver enzymes, because liver enzymes can get elevated with this medication. So that's one thing we'll have to monitor for. Now, I probably wouldn't plan on doing anything the rest of the day other than just taking it easy, drinking plenty of liquids. You probably won't feel anything though for about 3 to 6 hours. And hopefully you won't feel much, especially with
I'm hoping I won't feel anything. Yeah.
With the quarter dose and with that on board, I think you'll be fine. Okay. Congestive heart failure is another side effect of this medication. Not very likely for it to happen to you, but if for some reason you wake up the next morning, you've gained 5 pounds overnight, you might want to pay attention to that fluid retention.
Okay.
Okay. So let your doctor know. And you're going to open it up. It comes with a needle already. This is a 1/4 inch longer.
Ah.
Okay. That's why your doctor was nice enough to order you the shorter ones.
Okay.
You're going to hold this up.
I was going to ask you about that. Do you have to inject that? Does that entire needle have to go into the skin?
Yes.
It does.
Well, basically, I mean, if you had no fat layer on top of your muscle, the goal is to get it into the muscle. That's what the goal is. So if you can do it in 4 different places, your arms or your legs. If you're going to do it in your arm, it's 3 fingers below that shoulder bone, right there in the deltoid. You would not be able to do that to yourself in your arm.
Right. I was going to say, I just assumed it was going to be.
Yeah. If you're going to do leg, you want to do about a hand width above where the leg bends and about a hand width below where the knee ends. So right there, right there in that thigh muscle. So you're going to do like top to outer aspect, like right there. You don't ever want to do inner thigh. You've got a lot of nerves and blood vessels. You're not very likely to hit any blood vessels here. You might, nick a capillary or whatever and cause a little bit of bleeding. If that happens, just apply pressure to it. Don't rub or anything like that. Just apply pressure till it quits beating. Put a Band-Aid on. So when you get it out, you want to look at it. You want to make sure it looks clear like water. Now you'll notice that there's an air bubble in there.
Right.
We're going to leave that air bubble in there.
Okay.
Okay. But first, I'm going to have to get rid of it in order to show you how to squirt it out.
Right.
So now that I've got the medicine pushed out, I'm going to put some air back in it. I'm just going to back it down and put the air in it. The reason why you want the air in there is to help push the medicine further down. Out of that needle into the muscle. So when you give it, it's held up like this, and when you inject it, the medicine goes all the way in. Okay. So then
but there's not like so much air in there that the air is going to be injected into the muscle or anything like that?
It doesn't matter. It wouldn't hurt you anyway.
Okay.
Air just absorbs. It's not going to hurt. You don't want to go too slow though. Your nerve endings are on the outside skin. And once you touch those, you're going to feel that. And so if you go real slow, you're going to feel that. if you go real fast, you're going to feel it because it feels like somebody's stabbing you. But if you just go straight in, even motion, and inject. Let me get some water out here, fill this back up and let you play with it. So hold the skin taut. Go straight in. Perfect. Inject.
I don't know if I'll be able to do that into my actual thigh or not.
Those needles, the length of them are pretty intimidating.
Yeah. How long that needle is.
1 1/4.